My name is Alisha Bouchard, and for my career project, I chose to talk about a Certified Registered Nurse Anesthetist, or a CRNA. While I wasn't specifically matched with this, I was matched with a registered nurse. This is just a continuation of a registered nurse. What is a CRNA? Simply put, it's a registered nurse that administers and prepares patients for anesthesia. They often work together with surgeons, dentists, podiatrists, anesthesiologists, and other healthcare professionals to provide anesthesia care. Job duties of a CRNA include, but are not limited to, prepping the patient before any diagnostic, therapeutic, surgical, or obstetrical procedures, administering anesthesia for procedures, monitoring vitals and levels during procedures, going over postoperative instructions after procedures, and educating the patient. CRNAs are still registered nurses, so their job duties still include that of a registered nurse, such as monitoring, record, and report symptoms of patients and conditions, record patients' medical information and vital signs, order, interpret, evaluate diagnostic tests, and identify, assess patients' conditions. Consult and coordinate with healthcare team members to assess, plan, implement, or evaluate patient care plans. CRNAs can be found in virtually any medical setting. They're usually found in hospitals, such as operating rooms, but can also work in dental offices, birthing centers, emergency rooms, and plastic surgery centers. The road to becoming a CRNA is no easy task. First, you must graduate with a bachelor's degree in nursing, or a BSN. 1 year minimum of experience in an intensive care unit or an emergency room. The CRNA program generally takes between 2 to 4 years to complete. There is about 113 programs available in the United States. Lastly, you must pass the National Certification Exam. The U.S. News and World reported in 2016 the top 5 CRNA programs. Number 1 is Virginia Commonwealth University. Number 2, Baylor College of Medicine. Number 3, Duke University. Number 4, Kaiser Permanente School of Anesthesia, California State University. Number 5, Rush University. I have provided a link for nursing scholarships for those who are specifically going into CRNA programs. It is sponsored by nurse.org. I have provided a list of the highest paying nursing careers. Number 1 being a certified registered nurse anesthetist. Here is a map of the annual mean wage of nurse anesthetists by state as of May 2016. Northwest is leading in $180,000 to $242,000 annually. Florida being in the middle, about $155,000 to $163,000 annually. The job outlook for CRNAs is promising. They are projected to grow 31% from 2016 to 2026. This is faster than the average of all other occupations. This is not limited to medical occupations. It includes all occupations in database. Here is an employment map of nurse anesthetists by state as of May 2016. Florida employing between 1,200 nurses to 4,700 nurses. Some interesting facts or things you may not know about CRNAs. Since the American Civil War, nurses have been providing anesthesia. Currently, according to the American Association of Nurse Anesthetists, CRNAs deliver about 43 million anesthetics in the United States each year. CRNAs can practice with or without an anesthesiologist. They practice in every setting and are primary providers of anesthesia care in nearly 100% of rural hospitals. Agnes McGee established the first school of nurse anesthesia in 1909 in Portland, Oregon. I found this incredibly helpful. Advice from a CRNA. Cheryl Nemo, president of the American Association of Nurse Anesthetists, gave a very detailed description of advice for anybody pursuing a CRNA career. She talks about everything from how rewarding it can be to how stringent getting into the program and finishing it can be. My favorite part is when she talks about the minimum required before applying for school. She says, absorb advice and information like a sponge and become the best intensive care nurse you can be. So now that we've gone over what a CRNA is, what kind of working conditions they have, some of their job duties, on average how much they're making in the United States, what states are hiring and the job projection until 2026, and some advice from a current CRNA, maybe you'll have a better understanding and appreciation for certified registered nurse anesthetists.